Welcome to the Jeff Crilly Show. And now, here's Jeff Crilly.
Welcome back to the Jeff Crilly Show. With all that talk about KFC, I'm hungry. And we normally bring donuts into the studio, but not today because the doctor is in the house. Dr. Robert Edmonson. He's been practicing medicine for more than half a century. He's a noted cardiologist, and he is the founder of Marula Medical. Welcome to the Jeff Crilly Show.
Thanks, Jeff. It's glad to be here.
Okay, well, there's a lot of misinformation about diet and exercise, and you know, there's all these kind of fad diets and fad exercises, and you're a person who really wants to make it simple for people. What is the secret to a healthy heart?
Well, the secret to a healthy heart relates to our lifestyle, and as you know, there's an epidemic of heart disease in our country, which has a great deal to do with our American lifestyle. There's certain wonderful things about our life, about our country. We can adopt some of the cultural aspects of other countries where they don't have heart disease, dementia, cancer. It's just not heart disease. It's an issue related to our country and our lifestyle. That would be a major impact. From a simple standpoint, it's difficult to make it real simple if people have any difficulty with making changes in their lifestyle. But the diet is more principally plant-based nutrition. Exercising for a minimum of 30 minutes a day is worthwhile. The more vigorous, the better within your capacity and tolerance. Relaxation is a major issue that's important for everyone. What we do at Marula Medical, which is based upon the tree of life, it's a tree in Africa, is to try to get people to integrate all these into an easily understandable way to function and improve their health.
Absolutely, and I've been there several times. In fact, I've been there as a patient. You guys have drawn my blood, and I'm looking forward to finding out the results here shortly. But one of the things that you're passionate about is that don't eat too much red meat. And you know, we're in Texas, and there's a lot of people listening right now say, "By God, this is a birthright, a big juicy steak." But you're saying too much of that steak will kill you.
Well, you know, it's the steak by itself. The red meat is a major issue. Unfortunately, it's not just the red meat. It's really dairy and animal products are really the next negative thing for us. In the Asian countries where they basically plant-based nutrition, they don't have hypertension, they don't have obesity, they don't have the cancers we have, they don't have the dementia. So basically, that's very true. And the red meat is a big culprit, but it's more than just red meat. To get people to change, though, would require them understanding what it's doing to them when they eat it. That's not going to be to help for me to shake my finger in their face and say, eat this, eat that. They need to be educated. And there's material out there about this type of nutrition from very excellent experts, written in a way that lay people can understand what it's doing to our bodies and the ways in which the benefits of eating the proper foods. You know, I have a lot of patients that talk about how they love their steaks. And so I tell them, well, that's wonderful, but you should also love your arteries. Let me explain what the steaks do in your artery and decide which one you love the most.
That's awesome. This segment is sponsored by Outback Steakhouse. So, Doc, you're funny. Tell everybody about the whole idea of getting your heart checked out, because I know a lot of men are scaredy cats. I mean, they pretend to be tough men, but they don't really want to know the truth. They don't want to know how bad their heart is, do they, Doc?
Well, many don't, and it's not necessarily only men, but
right.
And also we think in terms about men, but the heart disease and strokes is the number one killer of men and women in our country. And so this conversation really is directed towards women as well as men. And I just say parenthetically that 50% of first evidence of coronary artery disease is a fatal heart attack.
Wow. Slightly
increased incidence in women than men. So waiting until you have a problem to make any lifestyle changes is an erroneous concept.
And these days there's easy ways to detect plaque in the arteries. Why don't you explain that?
There really is, and one which has been available for quite some time, which is very painless and it's very accurate. It's a calcium score of the coronary arteries. It's done with the CAT scan of the chest. It takes only a few moments to do it, The amount of radiation is about the same as a mammogram, so the radiation is not an issue. And it gives us the calcium detected in the four main vessels through the heart and a total calcium score. And that gives you an idea of your cardiovascular risk and also your prognosis for a significant interval of time. It's more sensitive than many of the issues like the Framingham scores, which you may have heard of, but there are a lot of people score your risk. This specifically gives you the information. It's very valuable to have.
And if you come along a patient who has a significant buildup, do they need surgery, or can you reverse that with diet and exercise?
Well, this is very much the individual, but the disease is the first effort, particularly if you're diagnosed somebody who's not already having symptoms, is to stabilize the disease, which can certainly be done with diet, exercise, relaxation, and medications when they're appropriate. I'm not a doctor who advises against statins. I don't think everybody should have them, but there's a lot of misinformation about their risk, and they're clearly of great benefit. They're shown to stabilize and reverse disease. Much can be done about it, but the early detection is, well, it's easier to diagnose the disease when it manifests itself and it's in stages where it's hard to deal with. It's easy to manage disease when it's early, before you've had problems with. That's very simple. That was actually stated in the 1400s. So much of these principles are not new.
How important is sleep to your heart?
Sleep is extremely important, and it's sleeping well. It helps reduce our autonomic nervous system stress. Too much sympathetic activity in our bodies damages our blood vessels. The lining of our arteries, the endothelium, is so critical to our flow. And the parasympathetic system is part of our autonomic nervous system. When we relax, it's activated. Very important. I might say parenthetically that sleep apnea is a big issue and very much underdiagnosed. And is critical because when people have sleep apnea, the oxygen saturation of blood drops very low, creates very adverse effects to the body, and it's very, very manageable and very important to recognize.
It seems like one of your life's missions is prevention, because as a cardiologist, I'm sure you've seen too many families devastated by a heart attack. Not enough physicians are talking about prevention. I think that's a problem, don't you?
It is, and also I'm glad to hear you make the comment about the families, because I try to get that across to some people that men, this is more typically men, who don't want to change risk factors, say, well, if it happens to me, it happens to me, I'll live the way I want to have them understand the impact of their loved ones. Because, yes, I was previously was an interventional cardiologist, which means I was doing angioplasties and putting in stents when stents were developed. Treated a lot of people with heart attacks, took them to the cath lab after we saw the emergency room with acute heart attack. So I've seen the devastating effects of not just heart disease, but vascular disease in general. And so I know it's preventable, and it's extremely important to address early. And that's really part of my motivation for prevention, because I've seen the ravages of the disease. I know what it does. If you think about our arteries, like the fuel line of an automobile, that's important for that fuel line to be open to get to run the engine. If it plugs up, the engine stops.
Right.
But you put a new line in, the engine restarts. Not your heart. You lose the blood circulation to your heart, that muscle's gone. It doesn't come back. And you can see a heart that contracts beautifully and then see one that's just barely beating. It's devastating and terribly discouraging to see, and it's preventable.
Well, I want to give a nice shout out to your son, because I know he works with you there at Marula, and what he brings is a mindfulness to the practice. And when you come in, you're on the campus of Methodist there off of Colorado in Oak Cliff, and you walk in and you're greeted by an organist sometimes who's playing to relax you for your blood draw, and there's some aromatherapy going on. How important is the relaxed atmosphere of your office?
The relaxed atmosphere is really critical, and what my son John brings is critical. Everybody knows that stress is important, but it's totally underestimated, the significance of it. Major cardiovascular risk factor. And what surprises me that John teaches mindfulness, relaxation techniques. We have an expander to show how to breathe properly. All these are factors which limit your cardiovascular disease, improve the quality of your life, and very much underutilized and understated. So it brings a wonderful addition. Something which surprises me, that when I start asking patients, which I have more recently, how much stress do you have? Yes, I have stress. Then ask them, are you interested in some techniques to deal with that? Almost universally, they are. Surprises me a little bit about how many people are really looking for the opportunity to learn things about their health, and particularly relaxation. It's critical.
And this past year, we saw some heart attacks of some people that everybody would consider too young. Carrie Fisher, David Bowie. I mean, we lost some legendary stars due to cardiovascular disease, didn't we?
Yes, and I think that goes back to the issue that the public needs to understand more about their bodies and about their hearts. It's not complicated. It's not just for doctors to know what our arteries are like, what the disease is like. When people have plaque forming in blood vessels, the vessel may be only about 40-50% blocked. That does not restrict blood flow enough to cause symptoms. If that plaque is aggressive and has a lot of what's called foam cells in it, it's almost like a ball and it ruptures. When it does, it creates a rough area inside the bloodstream. Platelets in our body aggregate and form a blood clot. It shuts the artery off within a few minutes. So you may have the plaque may be sitting there. That's why 50% of people die with first evidence of coronary disease, but the plaque was there. And it was not of us necessary. It's all this plaque formation is caused by our lifestyle, by our diet, by our stress. And if our cholesterols are high, the statin drugs rapidly stabilize plaque. There's so much can be done, and it's just not necessary.
And the website is MarulaMedical.com. Is that how people find you?
That's correct.
Marula Medical. Well, you and I should go out for a nice steak sometime.
Well, I'll tell you what, it would be nice for us to go to the steak house and then
have a salad.
And then kind of start showing people the right way to do things. And I might say, too, that I'll just say real quickly that I've heard about this calcium score equivalent to chest x-rays that help tuberculosis because they found disease and isolated people from it. We find that disease, and because it's an epidemic, when we change people's lifestyle, it may be the same as taking them off the street, getting away from society, putting them in a sanitarium. That little sanitarium of your home, where you change the lifestyle of all your family members and your associates, then start stopping the epidemic.
Oh, that's beautiful. We'll absolutely have to have you back again. Thank you so much, Dr. Robert Edmonson from MarulaMedical.com.
Thank you.
And when we come back, we will be talking to the Executive Director of Texas Lawyers for Children. That's next on The Jeff Crilly Show.
You're listening to The Jeff Crilly Show on Talk Radio 1190.